My name's Carley Weiss. I'm a physical therapist at the Washington Health System Children's Therapy Center. At Washington Health System Children's Therapy Center, we've been providing care to children and their families for over 20 years. Washington Health System Children's Therapy Center is one of the largest and most comprehensive pediatric centers in Washington County. We treat a variety of disorders ranging from neuromuscular disorders, autism spectrum disorder, orthopedic injuries, and many others. Our qualified therapists, we treat a variety of disorders, including gross motor and speech delays, autism spectrum disorder, cerebral palsy. We see kids with Down syndrome, orthopedic injuries, articulation deficits, cochlear implants, and many others. Torticollis is shortening of one side of the neck muscles. The muscle that's commonly affected is called the sternocleidomastoid. This muscle goes from your collarbone up all the way to behind your ear. If this muscle is tight, you may notice your infant tilting their head to one side or preferring to look over one shoulder. We treat torticollis by stretching the muscles that are tight and then strengthening the muscles that are weak. We also address any muscle imbalances that often occur in the shoulders, the trunk, or the hips. Oftentimes, a child with torticollis has muscle imbalances that cause asymmetry, such as only rolling to one side, or you may notice when they start to crawl, their leg might be up. A physical therapist can help with addressing these concerns and making sure your child develops symmetrical and age-appropriate gross motor skills. Some of the negative effects of not treating torticollis are problems with developmental gross motor skills, visual problems, balance problems, and problems with feeding. Ideally, torticollis should be addressed as soon as possible. Torticollis is either congenital, meaning it's present at birth, or it's acquired later in life. Congenital torticollis could be caused from abnormal positioning within the womb or an injury when coming out of the birth canal. On the other hand, acquired torticollis could be caused due to visual problems, reflux, or a spinal abnormality. You may notice your child has a flat spot on the back of their head, and they may have facial asymmetries, such as one ear is more forward than the other, or one cheek may appear more full. Some exercises and stretches you can try at home. The first one is called the football hold. Jen is holding Bryn against her stomach and using her forearm to go between her shoulder and her ear to stretch the left side of her neck. To strengthen the right side of her neck, she's being held on her left side, so she has to use her right neck muscles to hold her head up. This exercise is a rotation stretch. We're pretending that Bryn has a preference to look to her right shoulder, so we're encouraging her to look over her left shoulder and provide a little bit more of a stretch. The next exercise is active tracking to strengthen your baby's neck. Another great exercise to do with your baby is tummy time. While in tummy time, you can encourage them to track toys to their left and right to strengthen their neck. If you suspect your child has torticollis, I'd encourage you to talk to your pediatrician about setting up a physical therapy evaluation, or you could call us directly at the Children's Therapy Center. Our phone number is 724-942-6100.